My name is Audrey Young. I am the esthetician at Laser Skincare Center. During an initial consultation, when I first meet with the patients, we come into the consultation room and I'll sit down and just discuss with the patient what kind of issues they're having with their skin, what they'd like to improve upon in their skin, and I just try to guide them on that journey, giving them a great skincare routine to start with, maybe starting with treatments with me, how we can integrate my treatments with what the doctors can offer to the patients here at Laser Skincare Center. During the initial consultation, I'll try to assess the skin as far as what the skin type is for the patient. Some patients may think they're more of a drier skin when maybe they might be more combinations. So the minute we can determine what the skin type is, then we can better customize their skincare routine for them. So I can initially do that, and then they may have particular things that bother them. Say they have a little vein by their nose that bothers them, but I may notice they have some pigmentation on their forehead, some sunspots that they could also treat. So we try to get a totality of the problem for the patient and then, either treat one thing at a time or just let them know what can treat each issue that they may have. For patients, what I like to stress to them, or what I get excited about, is I try to teach them about different things that are integral in their skincare routine. So getting on a nice antioxidant is very important. Living here out in Southern California, we have the pollutants in the air, we have the sun exposure, so to be on a great antioxidant, we have a great vitamin C cream from a line of Revision. We have different C serums that are great, so I really like to educate people on the importance of the antioxidants, and that's integral in their skincare routine, doing that during the daytime, and then protecting their skin, obviously with an SPF, more of the broad spectrum SPFs to look at. We have great brands that we carry here. The Elta MD is very popular with the physicians. We also have the IntelliShade. It has a little tint, so patients like that. We try to simplify a routine for patients. Not everybody has the time to do 5 creams in the morning. So if we have a sunscreen that has a little bit of a tint, a little moisturizer for them, that encompasses an all-in-one cream for the patient, they'll be more accepting of that product. It makes it easier on their life. So I really like to educate people on that. And then at night, using great anti-aging products like a retinol, growth factors, peptides. So in our office, we try to give everybody that option. Everybody can't use everything. So, we have patients here with sensitive skin, so we try to direct them to maybe more of a growth factor product that would help them. Patients that are more sun damaged, older skin, they might be better off to use a retinol or retin-A's. So we really try to focus on what the patient will see their best outcome and what they will like and that their skin will enjoy. If it's irritating to their skin, they won't enjoy that. So that's where the skin typing really comes into play, to figure out, are they more, sensitive skin type? Is it more normal? So then your patient feels more comfortable with you because they are seeing those changes in their skin, and they're getting excited, their skin's getting healthy, and so then they just continue with us on their journey to their great skin health. The skincare line Revision, we really like their line. They have a great vitamin C lotion that we try to incorporate with all our patients. It's great for any skin type, so even sensitive skin types respond really well to that product. And it's more of a lotion. It goes on the skin very nicely, and it's one of the most stable vitamin C's out there, so it's probably one of the most effective, therefore. We really like their line. They have a great neck cream. It's called Nectifirm. We put patients on that after they maybe have their Ulthera treatment on their neck. It really helps to maintain that result that they've achieved with that Ulthera. They use great peptides in their products. They do several studies on their products just to make sure they're very effective and that your patient is getting the most bang for their buck for that product. They also have a great sunscreen called IntelliShade, and that one's really nice because it does have a tint to it, and then they have a matte format and then an original format. So the matte format is great for people with a little bit more oilier skin types. They tend to get more oil production on the skin, so the matte really reduces that shine for the patient. A lot of women like it because they can use it as their foundation or makeup. And it has great peptides in it as well. So it's not only a broad spectrum sunscreen, it's also an anti-aging cream because of the peptides that they incorporate into that particular product. We like the Elta MD skincare line. We mainly focus on their sunscreens they offer. We have their SPF 41. It's a tinted sunscreen, so a lot of patients really like that as well because it kind of evens out the skin tone for them, so they can wear it as their makeup or just on the weekends just to kind of even out everything. And then they have an Elta MD Clear, which is an SPF 46, and that one's very popular here because it's great for acne-prone skin, rosacea skin. So people with sensitive skin sometimes are a little leery with sunscreens. They say, oh, this sunscreen broke me out, I can't tolerate sunscreen, so I don't wear sunscreen. So this one is perfect because it's a broad spectrum, it's a zinc based, so it doesn't have that white finish that a lot of people, associate with the zinc sunscreen. And it's great for that acne-prone, rosacea-prone sensitive skin type. We also have a line here, it's called Zeo Skin Medical. It's from Dr. Zeno Baji. He recently created this line. I think the line has been out for about 3 years. We chose that line because it really helps our patients with pigmentation issues. They have several products that they offer with prescription strength hydroquinone. But what is great about their line is they now have a non-hydroquinone brightening agent called Brightenex, and that one has mainly a vitamin C base, and so it's not as aggressive on the skin, but they're still going to notice a nice blending of the skin, nice evening out of their skin tone. And it's very gentle on the skin, and they can use that indefinitely. And then they also have a great product called Retamax, and that would be their retinol cream to use at night. So using retinols help keep that collagen production going, because as we age, the collagen production significantly goes down. So using a retinol, a retin-A-based product just helps keep that skin tone nice, help with fine lines, help with wrinkles. So we feel when they combine the Brightenex with the Retamax, they're really getting an all-over evening of their skin tone and their skin texture.